Welcome to Observations, an open conversation about women's health. This is a space where physicians, patients, and other experts can sit down and have honest, evidence-based dialogue that cuts through the media bias and brings clarity back to maternal care and how we can care for both patients, mother and preborn child. With each episode, we will have real stories, real science, but also real questions about women's health today. From clinical insights to lived experiences, to aligned perspectives, and yes, also respectful disagreements. This is our goal, to bridge the gap between physician and patient, to empower informed decision-making, and bring back and elevate compassionate, fact-driven care. Now, a quick note before we dive in. Not every guest on the podcast is going to represent the views or positions of AAPLOG, but we believe that having open and honest conversations are going to make us better. So, grab your coffee, settle in, and let's get into today's observation. Welcome back to another episode of Observations. I'm your host for today, Jordan Butler, and I'm joined once again by Dr. Christina Francis, also the CEO of the American Association of Pro-Life OB GYNs. This is a very interesting episode today because it is a follow-up on something that we put out, something that is explosive, I would say. We have talked many times about the dangers of abortion pills, how easy they are to get, that literally anyone can get them. And sometimes I think that people think that we're exaggerating, that we're just fear-mongering. They're like, no, there's no way that can actually happen. And so, we kind of put it to the test, quite literally, actually. We had Dr. Christina Francis. She went online, undercover, and ordered these pills for herself. And if you haven't watched the video, it is in the show notes, but we are going to be doing a deeper dive into it and talking a little bit about how she got the pills, like what surprised her, like some of the stuff in detail that unfortunately we just weren't able to cover in the video. It's sad that we had to do it. It was sad to see the lack of safeguards and oversight, and we're going to get into that today. But Dr. Francis, thank you so much for being here with us once again.
Absolutely, Jordan. I'm glad that we're doing this. It's a really, as you said, a really important episode. And I think giving more information about the expose video that we did is crucial.
Yeah. So just kind of before we dive deeper into this, what exactly, I know I talked about why we did it, we wanted to kind of expose how easy it was, but what else kind of inspired you to do it? Like what made you think like we gotta show people like what's going on here?
Yeah, absolutely. Well, there's been other exposés of how easy it is to get the abortion pill. I've, been seeing it for the last few years, even of other organizations that have done great work. The Daily Caller did a whole investigative piece where one of their reporters got on several sites and showed how easy it was to obtain the pills. But to our knowledge, there had never been a physician who had gone onto these websites and actually intentionally put red flags in there. So things that should alert if there really was any kind of medical oversight over these websites, should have raised a red flag for any medical professional looking at it to say, you should not be getting these pills. It's too dangerous. And then explaining it as well, as we went through explaining why these things were so dangerous. And so we really wanted to see, are they actually, because that's the response, right, from the abortion industry is, well, we're asking these screening questions. In fact, during our case against the FDA, when it was at the Fifth Circuit, I was in the courtroom when oral arguments were being heard. And one of the questions that was asked to the FDA's attorney at the time was, well, how do you know that a woman doesn't have an ectopic pregnancy if she's getting on these websites to order the pills? And she said, oh, we asked screening questions. And so we wanted to see, okay, what are these screening questions and how robust are they about, looking at the responses? And so that's why we really felt like it was important to do this, because certainly I know from my own practice, our members know, we hear stories from our members of women coming in with really horrific complications that potentially could have been avoided had there been medical oversight before they got these pills.
Right. And just in full transparency, I had at one point also went on to 8 Access. This was about a year and a half ago, kind of to prove the point myself of like, hey, these pills are really easy to access. But I am a comms person. I am not a doctor. So um, I was in the room with you when you were ordering these pills, and I was learning. I was like, oh my gosh, I did not realize um, it was that bad. And again, I don't want to give away too much of the video, but just to briefly say, it's like you put in that you had a ton of really life threat. It would have been life threatening for you to get these pills with
Right.
the conditions that you had. Can you just kind of really do a quick synopsis of like what you told Aid Access about, who you were, what health conditions you had, you know, C-sections? Good grief, Dr. Francis. Just tell us a little bit about it.
Yeah, absolutely. Well, a couple of things. First, I'll say that the video that we have put out on social media does show us going through the Aid Access website. And one of the reasons that we chose Aid Access was because they are one of the largest, I believe, distributors of these pills online. But also because I've heard them claim in the past that they have a very thorough screening process, and so we wanted to test that out. So that's why we chose Aid Access. The other thing that I will say is, you said, Jordan, that you were obviously in the same room as me. This didn't make it onto the social media video, but one thing that Jordan and I said to each other after we got all the way to the point of getting the pills, we were like, there's no way they're going to give these pills. I mean, these answers that I gave were so ridiculous, from the sense of they were glaring contraindications and risk factors that no woman, girl should ever get these pills, that we just thought somebody would, obviously, if they were reviewing it,
Right.
know that this was not a real patient that was ordering these. But you'll have to see the full video to see how that turned out. But yeah, so some of the things that I put in there were that I was initially said I was less than 16 years old. Eventually had to put in a date of birth, so I picked a date of birth that would make me 13 years old. And again, that was not even, there was no hesitation even after saying that I was 13 years old, that these pills would come to me. I said that I had an IUD in place, or an intrauterine device, which would increase my risk of ectopic pregnancy. I said that I had a history of ectopic pregnancy, which would make me even more high risk for having another one. I said that I had 3 prior C sections. I've never seen a 13-year-old with 3 prior C sections, but again, the more C sections a woman has, especially if she's far along in her pregnancy, the higher the risk of uterine rupture if she takes, particularly the second drug, misoprostol. So I put that in as a red flag. They asked if I was on blood thinner medications, and I said yes, just to see what they would do. I said that I was on blood pressure medicine. I also said that I was anemic, which is another contraindication to taking these drugs, or a reason why someone shouldn't take these drugs. So I really put in just about every risk factor I could think of. Also, I wasn't sure about when my last period was, so really not sure what my gestational age was. All of these things, any one of which should have been a hard stop to say you need to be evaluated by a medical professional before we can dispense these pills to you, and they weren't. So it was really, I mean, I was really blown away in a bad way, to see that I could put all of those things in, and they let me keep moving through the process.
Yeah, and I think that's the shocking thing about the video for anyone that's watches it, and we'll play a couple clips here today. But just how easily you are able to go through the process. So one question I want to ask before we react to a couple of your moments here. What was something that really surprised you about going through the process?
Um, I think that there were probably 2 things that surprised me the most. Um, well, no, three things maybe. um, One was that we started on the Plan C website, which is kind of like a clearinghouse of all the different websites where pills could be available to you. And I put in my home state of Indiana because that's a state where abortion is largely illegal with only a few exceptions. And so I put in that I was in Indiana, and immediately I think it was 17 different websites popped up. So, multiple options for me to be able to get these pills, which clearly shows that the fact that the FDA is not requiring in person dispensing, which allows for this online distribution of these pills, is completely overriding every state's sovereignty, every state's laws that, I was part of testifying in support of our bill here in Indiana. I was down at the state house. Our legislators worked so hard. So many of us in the state of Indiana showed up to show support for this bill. We worked really hard to get these protections put into place in Indiana, and yet they're essentially moot at this point because of how these pills are being distributed. So that was surprising to me that there are that many options just openly available to me being in Indiana. Um, Another is that there were a few sites, a few websites that literally were just it was like shopping on Amazon. I mean, you
Yeah.
picked which pill pack you wanted, you put it in your cart, there was 0 questions asked. As long as you paid them, you would get the pills with no questions asked whatsoever. I mean, so for people who are trying to say that, abusers or parents who want their child to get an abortion, who, maybe the child doesn't want to get an abortion, can't just get these pills and force them on someone, are completely lying or just being, I think, willfully ignorant. So,
Yeah,
um,
misinformed too. I think
yeah, yeah,
yeah, especially
yeah,
if you're listening to the abortion industry and you're taking in pro-abortion media and you're not looking for yourself, you could very well think, "Oh yeah, they're just blowing this way out of proportion," and
right,
um
right.
it's
Yeah.
just not the truth.
Right. And when the FDA removed that in-person dispensing requirement, that's what opened up the ability for all of these websites to pop up. Their Aid Access was actually doing this before the FDA lifted that in-person dispensing requirement, but the second that dispensing requirement where a woman had to be seen in person before she could get the pills, the second that requirement was removed, dozens and dozens of these websites popped up. And, I think it's important to point out too that oftentimes when these are being discussed, these types of abortions are being discussed, they'll be referred to as telehealth or telemed abortions. Telemedicine means that you are conversing with a doctor or another medical professional in real time and they're evaluating you individually. That is not at all what's happening. And so I think it's really important for people to understand that. And the final thing that I think surprised me the most, and I think we'll get into this a little bit more, but was how quickly, so for Aid Access, the way you could tell that you were approved for the pills after someone supposedly reviewed all of your responses was that you would get an email with the payment link for you to pay them. And that's how you would know that you'd been approved for the pills. And literally 1 minute after I submitted my request with all of my information, I got that email with the payment information. So obviously, it's an automatically generated email. No one is reviewing this. And so that was actually really surprising to me because, as I said, we really thought someone's going to review this and say, no way,
Right.
somebody's making this stuff up. Yeah.
Right. And I was gonna say that was the thing that was probably the most surprising to me was the fact that there really was no doctor looking at it. Because I was because you put in all these different health conditions, and I almost kind of told you afterwards. I was like, Dr. Francis, I think that we may have gone too far here. Like, I don't think, surely they're not gonna let you get these. Like, it's so absurd. Like, there's no possible way that this person that you've created, the persona that you created, existed. And then, sure enough, like when you were on the couch, you're like, "Hey, I literally just got the email." So that to me was truly mind blowing. That there really was no doctor involved. And I think that really freaked me out. And I did not know that.
Yeah. Yeah. No, it was surprising to me as well. I mean, I guess maybe in some ways not surprising because we've had a hunch that that was likely what was happening. But But yeah, I mean, I think that this, and the other thing that I think is unique then about this video that we did that, again, at least to my knowledge, nobody else has ever shown, is that this makes it exceedingly clear that there is no one with any kind of medical knowledge. I think probably no one, period. I mean, it seems like it was probably an automatically generated email, but certainly no one with any kind of medical knowledge that is reviewing these applications at all. And, because of being a physician and knowing the dangers that each of these things that I put into that system represent for a woman or a 13-year-old girl who's getting on to order these pills, I can be very confident that these are not being reviewed by any kind of medical professional whatsoever, or we would have never gotten to the point where we could pay for these pills. So,
Yeah.
so I think that makes this a very unique video, and something that I hope will actually make a difference and will get the attention of those that have the ability to end this medical malpractice that's happening.
Yeah, absolutely. And let's go ahead and jump into one of these clips here. Talking about the lack of medical oversight. One of the things that we saw is that you could put in some of these health conditions, and it would allow you to assume the risk upon yourself to continue forward in the clip.
Okay, good. Warning pops up if you get pregnant with an IUD. There's a higher risk that this is an ectopic pregnancy. They go on to explain that abortion pills don't work with ectopic pregnancy. But again, I can click on, I understand that only an ultrasound can show if I have an ectopic pregnancy. So I'm just going to click on that. Look at that. I can keep going to order these pills. Again, this should be a hard stop. If somebody says they have an IUD in place, it should absolutely be a hard stop where they say, we will not give you these pills because you have too high of a risk of having an ectopic pregnancy. You must be evaluated with an ultrasound and provide us with those ultrasound results before we will send you these pills. They're not giving me a hard stop. They're making the woman who has no one counseling her take all the risk upon herself, and they're letting me keep moving through here to order these pills.
Wow, wow. So I know that, especially after, the fall of Roe v. Wade and its reversal, I think I've heard the word ectopic pregnancy so many times I can't even count, because it's been used as something to actually support abortion laws. But as we're seeing here, when it comes to them actually screening ectopic pregnancy, they're not actually doing a very good job. So just kind of walk us through, um, you know, and just a little bit, like, why is ectopic pregnancy so dangerous? Because even when you were going through this clip, the way that they were treating ectopic pregnancy, they're almost kind of treating it like winging a recipe, right? Of like, oh, I can just add a little salt here, a little seasoning there, and it'll turn out fine. It was almost kind of the same with these abortion pills. Like, oh, if it's okay if you assume the risk here. It's like almost kind of like they're estimating the risk and kind of hoping that it's going to be okay. But with life-threatening conditions like that, you can't do that. So, can you really just walk us through exactly how dangerous it is to do this and how much risk there actually is?
Yeah, absolutely. Well, I think this is one of the most concerning. Of course, every time or nearly every time these pills are taken, one life is ended, right? The life of the preborn child. But we also know that women's lives are being actively put at risk from these drugs. And as is evidenced by this video, they are receiving little to no counseling, certainly no individualized counseling whatsoever. So yes, ectopic pregnancy is not uncommon. That's the other thing that I think is really important for people to realize. Ectopic pregnancy happens in 1 in 50 pregnancies, 1 in 50. So that's a lot, actually. Um, and so it's really important that women be aware of the risks of ectopic pregnancy. It's a leading cause of maternal mortality when it's not recognized and treated appropriately in the first trimester of pregnancy, even here in the US, where we have typically fairly good access to care. I've taken care of many women with ectopic pregnancies, including some who almost died, who were on the verge of death, but thankfully made it to medical care in time. And so this is something very serious. It should be taken very seriously by medical professionals. And I'll tell you that, when I was still, I work as an OB hospitalist now, so I'm just in the hospital. But when I was still in office practice, if we had a patient who called in and said, "Hey, I've got an IUD in and I just had a positive pregnancy test," we got her in immediately for an ultrasound because of that risk of ectopic pregnancy, which is up to
Mm.
15% of if a woman has an IUD in place and she gets pregnant while the IUD is still in there, up to 15% of those women will have an ectopic pregnancy. That's a huge number. And the real danger of these drugs being given, and they actually acknowledged, which I was somewhat impressed by, I suppose, that these drugs don't treat ectopic pregnancy, but the risk. So people might say, well, then, what's the big deal? They'll go on to figure out they have an ectopic pregnancy. The big deal is that the symptoms of an ectopic pregnancy, especially when it's rupturing, which is where the most common location is in the fallopian tube. As the pregnancy grows, as the baby grows, it'll rupture that fallopian tube and cause life-threatening bleeding in the woman's abdomen. The symptoms that she'll experience will be some vaginal bleeding and abdominal pain. The problem with that is the symptoms that you're told with chemical abortion you're going to experience are abdominal pain and vaginal bleeding. And so she'll have those symptoms. She'll think that it's just her abortion happening, and she'll stay at home because she's not going to have heavy bleeding typically that she can see. So she won't be concerned about the amount of bleeding that she's having. So she'll stay at home. And with a rupturing ectopic pregnancy, seconds, minutes, hours can mean the difference between life and death. And if she is, far away from a hospital that has the ability to care for an ectopic pregnancy, and it takes her 2 or 3 hours after already waiting at home, something like that, it's very possible that she could die. And in fact, there are documented deaths of women who took mifepristone, did not know they had an ectopic pregnancy, didn't get treated for that ectopic, and then died because of that. So this is very significant. And, at another point in the video, we show that I say that I have a history of ectopic pregnancy. Those two factors combined, a history of an ectopic plus an IUD in place, that person, that woman would be very high risk for having an ectopic pregnancy. And again, there should not be an option of saying, I understand the risk, because how was I supposed
How
to, if I
can
was
she
not a medical
understand?
professional, how was I supposed to understand the risk? They did very little explaining of what that risk actually was.
Yeah, they downplayed it, I would
Yeah.
say.
Yeah.
Really did, and of course, it's like this would be, again, going back to that in-person dispensing requirement, this would 100% be a conversation that you would have with your physician, just like you would have with any other health issues that you're having. And you're right. I think what you pointed out, Dr. Francis, is incredibly important, that the symptoms are the same. Like, I could be taking the pills, I could even think that it's working properly, and I could actually be having an ectopic pregnancy, and like you said, like, time is of the essence. Seconds, minutes, hours could be the difference between life or death for a woman, and so I think that's very important, because I think even in some of the instructions, which, we can go through, it's just like, "Hey, this is what you should expect. You should expect there, to be bleeding." But it's also the same for ectopic pregnancy. And also the fact that you said that ectopic pregnancy is actually much more common than a lot of people think. So this is really quite serious. And it's a shame to see some people downplaying it. Of course, it's a shame to see aid access not taking the proper steps to inform women.
Absolutely. Well, and one other thing I just thought of that I found very interesting about that was they actually acknowledged that the only way to diagnose an ectopic pregnancy is by ultrasound. And
Mm.
yet, groups like Aid Access and other abortion industry groups have claimed in court that online dispensing of these pills is totally fine because you can rule out ectopic pregnancy based on symptoms and risk factors alone, which we know is not true. ACOG, the American College of OBGYN, says up to 50% of women with ectopic pregnancy will have zero risk factors for it. And so it's interesting that on the one hand, Aid Access is acknowledging that the only way to diagnose an ectopic pregnancy is ultrasound, but yet they'll claim that ultrasounds are not medically necessary. And the FDA has never required an ultrasound to rule out ectopic pregnancy before
Mm,
mifepristone was given, even when the in-person dispensing requirement was there. But that, I think, just proves why the FDA actually should be requiring not only an in-person dispensing requirement or have in-person dispensing, but also why an ultrasound should be required for that and for dating the pregnancy as well.
yeah, absolutely. It's a whole mess. And speaking of mess, let's get into the next part here. Talking about gestational age. Let's just go ahead and play the clip.
Enter the first day of your last period. If you're not sure, make your best guess. If you really don't know, we recommend you get an ultrasound. Okay, I'm just going to pick a day. Here, I'm just going to say November, and let's just say the 10th. Okay, that means I'm 12 weeks pregnant. What if because remember, they've already told me that I can't get these if I'm farther than 14 weeks along. So what if I say, what if my period actually, my last period was September 10th? You're 20 weeks and 6 days pregnant. I'm going to see that and be like, I really want an abortion. I don't care how far along I am. So let me just change the date so that I get back under that cutoff that they gave me. So now I'm going to go back to November and make myself 12 weeks pregnant, even though I could very well be 20 weeks pregnant.
All right, I'm going to stop it there. Now, Dr. Francis, I think you've touched on this before, whether it's been in conversation with you and I or even on air. But there is quite a big difference with using abortion pills in first trimester versus second trimester in regards to the risk to the mother. Obviously, the risk to the child is always death, which is the tragedy in itself. But when it comes to second trimester, women could be taking on additional risk. Can you talk a little bit about that, and then also talk about it in regards to this aid access survey for these pills?
Yeah, absolutely. Well, as you said, the risks associated with mifepristone and misoprostol for an abortion increase exponentially for each week of pregnancy beyond really about 7 to 8 weeks of pregnancy that a woman is. So, which is why actually when the FDA originally approved the drug mifepristone for abortion, they limited it to the first 7 weeks of pregnancy because beyond that, the studies even that they were relying upon showed that the rate of complications increase. We know that if a woman has a chemical abortion at 10 weeks of pregnancy, even her risk of needing an emergency surgery, a potentially emergency surgery to complete her abortion is about 1 in 8 to 1 in 10. If she takes it just 3 weeks later at 13 weeks, which by the way, aid access would give her because they will give pills out up to 14 weeks. Her risk of needing a surgery to complete her abortion, again, oftentimes emergent, goes up to 1 in 3. That's a
That's
huge
crazy.
jump. And again,
Yeah.
was there any sort of explanation on the website of, well, the farther along you are in pregnancy, there's increased risks? Absolutely not. That was never mentioned anywhere. And so that's really, really important for women to know the risk of hemorrhage or really heavy bleeding, the risk for a need for emergent surgery increase significantly the farther along in pregnancy a woman is, not to mention the mental health toll that it takes on women in any abortion, honestly, even a very early abortion, but especially the farther along in pregnancy she is, the worse the pain is going to be with her abortion because she's going into labor and it's going to be harder to deliver a baby that is 18, 20 weeks, just physically harder than it is at 8 or 10 weeks. But also, as we all know, the farther along in pregnancy a woman is, the more developed her baby is and the more easily identifiable that development is. And so we know from stories that we're hearing from women, from groups that we work with that work with women who are post abortive, that this takes an extreme mental health toll on women. The fact that they see their baby, they're being told to flush their babies down the toilet, but they see their baby, they realize that's their baby, and they don't want to do that. And I think they're sort of met face to face with the reality of this decision that they've made.
Yeah, and more reason to have the in-person requirement,
Absolutely.
because I was even just thinking now, I was like, let's say they did have, even say there was no in-person requirement and maybe there was a requirement of verification of pregnancy. maybe that's something that could also easily be faked, and they're still able to get those pills. And so having somebody to talk with them in person would immediately lead to some kind of ultrasound, you would hope, with a doctor. I'm not a doctor, Dr. Francis, so you tell me if that's true or not. But if I were to have an appointment with a doctor, maybe that would be their next step for me, would be to get that ultrasound and actually confirm the age of my child. And I also heard this somewhere, and I think it's true, but women that actually see their babies on the ultrasound machine, they have a higher chance of choosing life for their child, which is another great benefit. But once again, with this aid access site, it really is just a bunch of winging it. It's like a bunch of guesstimations, which I have to imagine is uh, very problematic, especially when it comes to somebody's health.
Right. Absolutely. Well, and even playing devil's advocate a little bit, if they truly cared about women and women's health, there would be ways that they could verify this. And, they could say, oh, you have a history of an ectopic pregnancy. We are going to stop you right here unless you can send us proof of an ultrasound done on you that shows that this pregnancy is inside of your uterus or shows how far along you are. They don't ask for proof of anything. They don't ask for proof
No, they don't.
that you're pregnant. They don't ask for ID to prove that you are who you say you are, obviously, because I would have not been able to prove that I was a 13-year-old girl. Yeah, they don't ask for any of that. So there are ways that they could do it. And of course, I still would argue that it's dangerous to do it online without an in-person visit. But there are certainly things they could do to try and at least make it a bit safer. And they don't, which to me tells me that they are driven by profit, not driven by patient safety. And they clearly are putting their profits ahead of the health and safety of women and girls.
Yeah, that would be my opinion too. That profit comes before the two people involved, which is obviously the mother and her child. I'm going to show you this next clip that is really infuriating for a lot of reasons, and it'll actually kind of tie into the conversation that we're already having here. This is, and just for context, and for our listeners. In the video, she's made it to the end of her journey going through the aid access survey to get the abortion pills. And then she's reading off the aid access agreement. And so I'm going to go ahead and play that for you.
Okay, let's go through agreement using aid access service. I agree with the website's rules. I agree to share this information with the medical team. I agree my data can be used for research. I understand I will get emails about my care, and I agree to this. I understand my pregnancy is dangerous to my health. I am just reading this right now as I'm filming this video, so this is blowing my mind. They did not talk about any of the risks other than bleeding of mifepristone, which are significant. And yet they want me to agree to understand that my pregnancy right now is dangerous to my health. This is manipulation of young and vulnerable girls and women. It is not medical care. It is not informed consent. This is really making me angry.
All right, so we'll end it right there. My pregnancy is dangerous to my health. My off the cuff response is, well, it would make sense that they would say that because they need you to think that your pregnancy is a problem so that they can profit off of it. That is my opinion, of course. But obviously, in the video, Dr. Francis, you were pretty shocked. You were pretty shocked about it. Just what was going through your mind, and as you've kind of had some time to think about it, what's your reaction to it?
Yeah. Well, I mean, it's just pure lies and manipulation of, again, women and girls who oftentimes are in a very vulnerable, scary time of their life. And literally the only dangers that were laid out that clearly in the entire process was that pregnancy is dangerous to your health. And I want to make clear that this was not individualized to me. It wasn't because I had put all of those risk factors in there. This was their standard form. So
Mm.
and they're just coming out and saying pregnancy is dangerous to your health. They actually went on to say abortion is much safer actually. So they, and then they also at the beginning when they talked about how effective chemical abortions are. They quoted like at the earliest stage of pregnancy. So they quoted the absolute best statistics that they could possibly quote about chemical abortions, drug induced abortions. And then they say pregnancy is dangerous to, and not only are they saying pregnancy is dangerous to your health, but it's set up in a way that you are actually agreeing to all of these things. So they are making women agree to the fact that, or they're claiming fact that pregnancy is dangerous to their health. Now, certainly some pregnancies can cause health complications for sure. But those can be managed and the women should be supported through that. What are they ignoring here? Well, one, they're ignoring that a life has ended, a baby's life has ended. They're ignoring the risks to mom. They're also ignoring the multitude of health benefits to women of pregnancy and childbirth, which are many. And they're not talking about that. So, fully, if I was totally middle of the road on this issue, which I don't even actually know that you can be middle of the road on the issue of, the taking of innocent human life, but let's say that I was. I should still want, or even if I'm very pro abortion, I should still care about women having fully informed consent. And that means balanced and accurate information about anything that they might be looking at taking or undergoing. It means, quoting legitimate chances of risk. It means quoting benefits to them. It means giving them alternatives as well. And of course, none of that happened. So this is just really not only neglectful of what actual healthcare looks like for women, but also it is lies, it is manipulation, and it is really, I think, pressuring women into one decision based on inaccurate and incomplete information.
Yeah, and I want to hit on something that you said there, and you said it real quickly, but I really want to land there for a moment. You talked about the benefits of pregnancy, and a lot of people, especially in the more pro-abortion space, they really fearmonger around motherhood, and obviously, especially around pregnancy, because there is, unfortunately, a desire for women to abort their children, and that's what they want. Um, Allegedly speaking. But I want to talk about the beauty of motherhood and where you feel like that message is missing and where women just aren't maybe perhaps they aren't informed. I don't want to put words in your mouth, Dr. Francis. I'm just kind of thinking out loud here, but talk a little bit about the beauty of motherhood as you would like to see it in the United States.
Yeah, absolutely. Well, I think in this post Dobbs world that we live in, um, certainly the abortion industry and its allies have used pregnancy complications as a justification for induced abortion. And so these very real, but thankfully relatively rare and difficult situations get brought up a lot about life threatening conditions that do happen in pregnancy. And again, I've taken care of many high risk pregnancies. So I know that they happen. I also know that there is a way for us to treat many of those conditions as well. That certainly does not involve abortion. So those definitely happen. But what I think we've gotten to in the almost 4 years now, 3.5 years since Dobbs, is I think many women legitimately think if they get pregnant, they will die. I mean,
Hmm.
because I think that all they're hearing about are these potential pregnancy complications that, again, I'm not saying though they're not real, but I think they just envision one, that they're much more common than they are, and two, that there aren't any benefits to pregnancy or benefits to motherhood, that beauty of motherhood that you referenced. And so there are many things, of course. Mothers that you talk to overwhelmingly will say that their lives were changed for the better by their children. And I get the joy and opportunity. I just worked a hospitalist shift yesterday and last night and had a middle of the night delivery. But even at 4:35 a.m., It's one of the most amazing things for me to get to be a part of. What a privilege and an honor for me to get to be a part of that as I see women becoming moms, at least like welcoming their child into the outside world for the first time. And so that's really amazing. But there's also health benefits to women. We know that women who've had children live longer than
Hmm.
childless women. They have better mental health throughout their life, lower risks of suicide, depression, and anxiety. There are, cancer benefits, cancer reduction benefits to pregnancy, reduced risk of uterine and ovarian cancer, significantly reduced risk of breast cancer for women who have had full term deliveries and then go on to
Oh,
breastfeed their children, just to name a few. I mean, there's very fascinating things like a decreased risk or improvement in multiple sclerosis symptoms sometimes from pregnancy. And then there's also something called microchimerism, which I think is so cool, where cells from the baby actually get into mom's bloodstream and stay there for the rest of mom's life and can actually help repair damage to cellular damage in mom and help repair disease processes. So
wow. No idea.
I
That's crazy.
yeah, it's amazing. It's amazing. But none of these things are talked about very often. And so, at APLOG, we really believe that life affirming healthcare is the best kind of healthcare possible because we celebrate the lives of both of our patients. We work so hard to maximize both of their health, but we also believe in celebrating the joys and strengths and beauty of motherhood and helping women feel empowered to be able to take on that very special role.
Yeah, and I think that's what it should be about. And if that survey shows anything in the agreement that your pregnancy is dangerous to your health, they're definitely not promoting the beauty of motherhood, more the fear of
Right,
motherhood,
right.
for sure. So let's go ahead and get into a fun part. Well, I say fun, it's not actually fun, but get into a part of this that we didn't actually get to film. And that was the so called aftercare of after you got these pills. But actually, before we get into the questions, kind of give me just your initial thoughts when you first got the instructions.
Well, I mean, first of all, again, the fact that I got the instructions showed that they were going to be shipping me the pills. So I still was just flabbergasted that with all of those risk factors that they were willing to do that. But also it just struck me like this is not the way that women should receive medical information or counseling. Especially not women in a very vulnerable situation. This is a situation where uh, she deserves and should be in an exam room sitting across from a doctor or another medical professional talking to her, giving her specific instructions that are specific to her particular situation. And of course, this is again an automatically generated email that goes to everyone. And so, and if someone's ordering these pills to force them on someone else, I'm sure that they're not also passing along these instructions. So, what about the woman who has this forced on her and has no idea what to expect? So yeah, I think that was my overall impression. And just also they just minimize, I think, really throughout the email, what this experience is truly going to be like.
Sure.
That it will be like she's in labor and that she will have bleeding for a very long time, likely. So bleeding can be heavier than a normal period and may include clots. Yes, it will. And that bleeding, if they're doing this at less than 6 weeks pregnant, they may have less bleeding than a period. I have never found that to be the case. So that is inaccurate. And then they don't say anything about the fact that many women will bleed for up to a month after taking these drugs. So really just minimizing the physical effects of these drugs, but and certainly nowhere in there are the mental effects mentioned. So
Sure. Yeah. And no, that's certainly a problem. And one of the things that I was kind of curious about, as somebody who's not a physician and just kind of reading this through the layperson's lens, it says that your first day that you want to swallow one mifepristone tablet and to take it with water, and then for day two, you want to take four misoprostol pills under your tongue, and then 3 hours that you need two more misoprostol pills, in your cheeks or under the tongue. And then again, 3 hours later, you want to take another two misoprostol pills in the cheeks or under the tongue. Um, so that kind of struck me a little bit because it does that feel excessive? Like that's a lot of misoprostol. At least just when I see that many tablets, I'm like, I was under the impression that you take the pill, mifepristone, and then it's only after that just one time you take the misoprostol.
Yeah. Well, so, again, this is, I think, the result of them giving the same advice to every single person. So typically, my point of reference that I have as a practicing physician is using misoprostol alone to medically treat a miscarriage. And typically, what I would do in that situation is I would tell the patient how many misoprostol tablets to take, tell her if she hasn't started having heavy bleeding how much to take maybe one more time a few hours later. But then beyond that, I would say, if you don't feel like you've passed your baby, or whatever pregnancy tissue may be left in your uterus, then we need to see you, and then we can talk about what's next. But here, I think that they are just, first of all, this is not sort of the standard recommended protocol to do an automatic repeat that many times. I mean, it's not, if you haven't had bleeding, then do this. It's just, you just take
Just
this.
do it.
And so, yeah, exactly. So it's not standard, but I think it is a result of them trying to ensure that women do pass everything, their baby and everything associated with the pregnancy, but giving, again, just across the board general instructions and not individualized to the woman who is seeking the abortion.
Okay. Yeah, no, that's really interesting. That's good to know as well. Um, another part that I was curious to ask you about was the HR negative blood type and the ROGAM shot. Um, I know a little bit about this, but from what I know, like it's very important that if you have a certain blood type, you need that shot. Wouldn't that also be something that should have been discussed in, I guess, the pre-consultation stage of getting the abortion?
Yeah, no, absolutely. So yeah, so if a woman is Rh negative in her blood type, so that would be, if you have an O negative blood type or an A negative, something like that, then there is a risk of getting what we call sensitized with any pregnancy if the baby is Rh positive. And then that can cause loss of future children. It can cause brain damage in future children. And so it's really important that women who are Rh negative get a ROGAM shot. And that is even true with an abortion or a miscarriage, even if it's not a term delivery. And so you're absolutely right. Many women, especially if they have not had babies before and delivered a baby before, they won't even know what their blood type is. So they may be saying, if you're Rh negative, you should get ROGAM. First of all, where's she supposed to go to get ROGAM? I
Right.
mean, they're not giving it to her. So, and how does she know where to go to get ROGAM? She may not even have a doctor of her own. She may not have any idea what her blood type is. So, absolutely, that should be a part of the pre counseling, not an afterthought. Because the other thing is, I'm just scrolling back to see if they say a time frame. No, they don't even say a time frame. Like, you need to get ROGAM within this amount of time. Ideally, it would be within 72 hours of the potential exposure. So within 72 hours of their abortion. Um, and they don't say that. So what if she's like, "Oh, I'll get around to that when I have time. I'll go 6 weeks from now." Now she's sensitized, and now her future pregnancies are in jeopardy. So yeah, just continued lack of care of the woman, of her future children, her future fertility, that sort of thing.
Yeah, and that's kind of what I thought. I was like, that feels like something that they should have talked about way sooner. But again, if you don't have an in-person visit, you don't have an actual physician in the room, stuff like that can happen. One last thing I just wanted to at least point out and get your thoughts on. At least in this email, it tells the woman what she might see. Um, one of the things here. There's multiple bullet points, but it says at 9 weeks you might see a pregnancy around 1 inch long. At 12 weeks, you might see a pregnancy around 2 to 2.5 inches long. At 14 weeks, you might see a pregnancy around 3 to 3.5 inches long. The word that's missing there is baby,
Right.
or fetus. It's very interesting to me that they use such removed language, because if they imagine those bullet points with the word baby. Like,
Right.
imagine, like, if a woman got those pills and, like, read that part, be like, man, it's like, this is gonna be my baby, and this is how long my baby is gonna be, how big my baby's gonna be. And so I just found that to be very sad, of course, that they obviously can't even use the proper language because it would humanize the child far too much.
Yeah, absolutely. Well, first of all, let's use accurate medical terminology. Um, so, yes, pregnancy means the condition of being pregnant. So, it makes zero sense, even grammatically, to say a pregnancy that is 1 inch long. Yeah, it is
So weird.
linguistic gymnastics, where, as you said, they're trying to avoid talking about what's actually happening, which is you will see your baby. But even if they wanted to use the terms embryo, if it's prior to 8 weeks, or fetus, if it's after 8 weeks, that at least would be medically accurate. To say pregnancy is, yeah, completely inaccurate, but also very dehumanizing of that preborn child. And again, not giving women fully informed consent for them to know you are going to see your baby. It will not look like a clump of cells. It will not look like just a clot. You will see your baby. And depending on how far along she is, she may see their little arms and legs, things like that. And so that's, again, it's part of informed consent for women to truly understand what is going to happen to her and to her baby. She needs to understand all of these things. And of course, that's not being conveyed to them whatsoever. So,
No, it's not. And if you guys want to see just the extent of this, I mean, you've got to watch the full video. I'd really encourage you guys. Obviously, we encourage you guys to share all of our episodes, but we really would love for you to share this episode, and also to share the video of abortion pills being exposed. Um, Dr. Francis, is there anything else that you would want to add before we conclude our episode today?
well, I just, first of all, I'm so glad we got to do this deeper dive into just, I think, the unreal nature that uh, of how these pills are being dispensed. And I think both of us even were surprised at how it's just completely lacking any kind of medical oversight or care for actual women's health or girls' health. We didn't even get into talking about the fact that a 13-year-old could be very easily being sexually abused, and this was not even looked into or asked about on the website. And certainly there was no reporting of that, which we as physicians are mandatory reporters of sexual abuse of minors. So I'm just so glad we had this chance to do a deeper dive. I would encourage people to watch the full video. I know we're going to link it in the show notes on our social media account. And also, I would encourage you, if you're watching this, to contact your member of Congress to ask them to demand that the FDA do something about this. Contact anybody you might know that would be in the administration, but you can do that through your member of Congress. They can request, and I know they have, as has AAPLOG, requested for the FDA to do its job and protect women. We will continue to do that as an organization to fight for the dignity and the protection of both of our patients, both mom and baby.
Absolutely. We'll make sure all that information is down below. Thank you, Dr. Francis, for joining us once again. And thank you to our listeners for joining us. We will see you on the next episode of Observations. We hope that you enjoyed today's episode of Observations and that it broadened your perspective on women's health and how we can care for both patients, mother, and preborn child. If you like this episode, make sure to give us a 5-star review where you can find your podcasts. Make sure that you like this on YouTube and subscribe to our channel for more episodes coming up. And if you have any suggestions on any topics that we should cover or guests that we should have on, make sure that you email us at media@applog.org. Again, thank you for joining us for today's observation, and we'll see you in our next episode.